So Rob, why don't you tell me a little bit about your background in therapy and treatment?
Yeah, I'm from Sydney, Australia, and like many therapists, my clinical training basically captured CBT. We get was usually 6 years of training if you're master's trained, or training goes up. The sky's the limit, but and usually we come out of our clinical training with about 2 years of pretty intensive CBT training as a psychologist. And my own journey was basically found, CBT was effective for maybe half my patients or a little bit more than that, but I was working actually with very chronic sort of cases and found the limitations of that approach fairly quickly. And so of course was hungry for more and hungry to learn, more about how I could help more of my patients. And I did what any good therapist would do and started running around and getting addicted to trainings and trying to do as many trainings as I could. And I did a bunch of things, but one obviously that I did that stuck with me was schema therapy. And I did my first training in schema therapy now nearly 12 years ago. And it was just one of those things that resonated with me automatically as a human, as a person. I was like, okay, now this actually makes sense for me. I can understand this, and I think this would work on me. So it had a sort of face validity for me, and then found pretty quickly, going back to work, I just felt more effective at work, or in applying this approach. The bottom line. We all as a therapist want to feel effective, because the bottom line is we're there to help people. We're there to help, people that need it. So there was that process happening, and of course then, I ran around and got my own supervision and did every schema training I could get my hands on, and did my own accreditation through the international body, International Society for Schema Therapy, and then got a chance to start getting into training about 2015. Starting back in Australia, and then now I'm blessed enough to be getting invited to places like Thailand to run training events. So yeah, no, it's been a good journey. The only other thing I'd say is, and I think your therapist would be able to relate to this. One of the really cool things about being a therapist is that you get to help people, and the feeling that comes with that, and seeing people change their lives and things. And I'm sure you see that on a daily basis, and might be why you guys are into this. I'm sure of that as well. Yeah. And yeah, as a trainer, the feeling for me is that, can you imagine training up 20 or 40 people in an approach that you believe in, and the idea and the feeling of they're going out now and those 20 people are going to go and help how many people, So, I think you can maybe see the motivation in that. It's awesome. So that's what drives me. Yeah.
I just want to explore a little bit more about schema therapy from your point of view and what it is, what the benefit to our clients and our therapists is, and maybe you can give us some answers.
So probably the best way to think about schema therapy is to place it within, the other therapy modalities that are out there. And so schema therapy evolved out of CBT, you could say, the CBT movement. And which is, of course, CBT is a very strong therapy. I think you guys practice it here actually. Certainly back in Australia and worldwide, it's one of the most practiced and researched therapies in the world. But what has been picked up relatively quickly in the CBT world was that a fairly large proportion of cases that weren't getting better. The bottom line. So schema therapy started to evolve out of that clinical problem. That depending on the populations you're working with, anywhere between 30 to 50% of patients that weren't responding the way that we would like, perhaps, right? And so it started to be designed initially around chronic problems. People who kept coming back or had problems that wouldn't remit. And the founder of schema therapy, his name's Jeffrey Young, and this is how the story goes, at least. Sort of started to notice that there were some similarities between the patients that seemed to have those more chronic problems, and in particular, what he sort of found were that the sort of childhoods often of people who had more chronic problems, they tend to have their issues were more steeped in the past, in going back to being a little girl or even a teenager or whatnot, and so in other words, another way of thinking about it is we probably needed to go a little bit deeper in the therapy, in that CBT works very much almost in a skills-based way. That if you're taught, the right way to think and the right kind of skills in terms of behaviours, that you can achieve a healthier result, right? Now in Schema, I would say you probably need to go a little bit deeper than that and start to be able to capture an understanding of, and also start to work with some sort of a deeper healing of more like the emotional part of that underneath, that might be driving a lot of the surface level sort of symptoms. So that's probably my best kind of lay kind of explanation of why Schema came about and what it focuses on. Focus on those more deeper patterns underneath the surface, often related to sort of childhood problems and issues to do with that. So you could say also it's a little bit more of a trauma-focused model as well, that assumes that a lot of the issues that we focus on, things like addiction, for example, not always, but with a high, in a high proportion of cases, that there's other stuff underneath that might be, the addiction might be papering over some cracks and whatnot.
So in terms of Schema therapy, what types of techniques would you use in the approach to using it?
Yep. Okay, so in a Schema approach, there are broadly 4 intervention points, you could say, things that we would do to try to get the healing going. To those first 2, in Schema, we go a little bit deeper, and so we're going to also add healthy relationships. Okay, so in Schema, we want to focus initially on getting a healthy relationship happening between the therapist and the patient, or the client, or whoever you're going to see, and using that example of one relationship and starting to get that right, that the person can start to experience what a healthy relationship looks like in a therapeutic relationship, and so then they might be able to start to extend that out to their real world. Okay, so we want to fully harness the power of that relationship to help the person change. So we call that limited reparenting in Schema therapy. The other part that's a bit different is what we call experiential techniques, or emotion-focused techniques. So this is about trying to help people feel differently. All right, so it's not only like changing where you think up here and changing your behaviour out here, it's also trying to get some healing happening on a felt level. So there's techniques such as, sometimes we would use therapeutic chair dialogues, for example, where we would put like a side of, we all have different sides. This is another thing, Schema therapy. There's a side of us that might be causing us pain or making us feel guilty or something like that. And we're going to work with those sides by putting them on a chair, separating them out and having a dialogue with that side to try to create some healing. So overall, intervention points, we're thinking about, number 1, healthy relating. All right, we're trying to fully harness the therapy relationship and also help people relate and get their needs met more in real life. Healthy thinking, we're trying to help people adopt healthier thinking styles that are going to help them get their needs met. Healthy feelings, we're trying to promote some healing and help people feel more empowered, feel more hopeful about things and feel less, maybe vulnerable and scared and all that stuff that might be going on. And lastly, we then start to look at healthier behaviours and how they can start to change, out there in the real world. So they're the kind of the overall sort of idea.
And from a client's perspective, what do you think a client will get out of this? And what's the kind of success rates you've seen in terms of helping clients with Schema therapy?
Yeah, I mean, it always depends. It depends who you're targeting. But, I do a fair bit of training these days with therapists. Most therapists really, are very passionate about Schema therapy. They get into it. It's the reason I got into it. Really, I started seeing quite good results, even with patients that I would have thought of as being, difficult to work with, or that weren't necessarily getting better. And so, I mean, most of my patients, do very well with Schema therapy. Of course, it's not a panacea for everything, and there's other factors, people's motivation, where they're at, that sort of thing always matters. But we do get very good results. And in fact, we've now got several randomized controlled trials for Schema therapy that show Schema therapy to be effective with our most chronic cases. Yeah.
Okay, and I believe that Lana will be the first rehab that you're aware of in Asia that's actually using Schema therapy within their program.
Yeah, sure. Yeah, that I'm aware of. It's certainly the first time. Yeah, that we've been approached to train up all the therapists in a rehab facility such as this. So yeah, I'm really proud to be involved in that. You know, and I'm really hopeful that you guys and your clients are going to get a lot out of it. Cool. Yeah.
Okay, so you've been here for a day. You've had a chance to look around the centre, have some food, freshen up. What's your impressions of Lana compared to rehabs in Australia?
I think it's amazing. It's amazing what you guys are doing. You know, I guess the issue is I didn't really know you guys existed, and of course I'm aware of how rehab usually would go back home in Australia. So yeah, no, it's lovely. The grounds are lovely. The people are lovely. You know, the food is lovely. Looks like there's plenty of opportunities to get involved in physical activity and things. So yeah. I mean, now that I know you guys are around, and I personally would definitely refer people. I mean, it's a bit amazing to me this place exists, and then I wonder about what do you guys do for to reach out to people in Australia? What are the unique benefits of people coming here as opposed to maybe doing rehab back home in Australia or elsewhere?
I think the first thing, about 40% of our clients are from Australia. So we definitely reach out through the traditional internet and direct marketing and through referrers as well to Australians that come here. And probably the biggest reason is price. In terms of a private rehab cost in Australia versus here, we're about 1/2 to 1/3 the price of Australia. But it's really getting away from distractions. It's getting away from just Australians and having a worldwide community of people from America and England, Asia and the Middle East, all with the same kind of problems, but dealing with it in their own special way in Atlanta. We only take 24 private clients, so we're very, very small, which means we have a real individual care for each client. So we're not a one-size-fits-all or a rehab in terms of how we deal with people. So I think in terms of price, individuality, in terms of getting away from distractions, being in a wonderful culture like Thailand is very empowering as well. A lot of people from Middle America or Middle England or living in Australia, they haven't experienced.
And you're saying that we're at a fraction of the price of what you'd be doing in Australia, and you can do that all the way in Thailand.
Yeah, it's really just the only other extra expense will be the flight. And these days it's really not that difficult, kind of 8 or 9 hours at most from Melbourne. It's not that far away to get into a different environment and enjoy a program at a fraction of the price.
Yeah, okay, that sounds good. And the other thing I guess I was wondering is, I know you guys do some other therapies. You're interested in doing schema therapy at the moment and rolling that out.
Yes.
I'm aware most of your therapists would have been trained in CBT, and I've heard other things such as EMDR, and even more exotic things, thinking about like yoga and physical, looking after physical elements. Could you say more about that? About like what else are you guys doing here other than schema therapy? And
Sure. I guess first of all, getting someone clean, if you like, is probably the most obvious thing we do first. You're getting people detox and withdrawn from medication, which is fully included. Detox medication, the whole detox protocol under my psychiatrists and nurses and staff is fully included. But then it's really figuring out the therapy program suitable for the individual. Some people require more trauma-based therapy, like obviously CBT, DBT, and of course EMDR is something that we practice here at Lana as well. And it's all included in the price. There's no difference for the therapy, it just depends on what they
And now you'll be able to add schema therapy into that.
Now schema therapy on top of that's going to add something for our clients.
Another option.
But it's not just therapy and getting someone clean, it's the whole holistic approach. Fitness is very, very important. Nutrition is very, very important. And things like early morning yoga, mountain biking, Thai boxing, massage twice a week, Reiki twice a week, sound bowl therapy, art therapy. It really is a proper body, mind and soul treatment program that we provide, not just getting someone clean. It's all about dealing with the underlying issues, of which that's why Schema, we brought you out here to do this training.
So there's a real synergy there. Yeah.
Exactly.
Nice.
Very much so.
I'm glad to be here.